A shocking statistic from the World Health Organization estimates that substandard and falsified medicines kill hundreds of thousands of people globally each year. For many South African families, buying medicine is a life or death necessity. But there is a growing silent threat that what they buy to heal could in fact cause more harm or even kill. On 30 September, South Africa will become the first country in Africa to launch a comprehensive and national action plan to combat falsified and poor quality medicines, uniting government, regulators, law enforcement and industry like never before. Joining us now is Mokgadi Daphney Fafudi, SAHPRA's head of regulatory compliance. Mokgadi, appreciate your time today. Now, let's start with the threat itself. How big is a problem of falsified and substandard medicines in the country?
Hugo, it is growing. If I have to start from 2022, for example, it has been growing almost double annually. So it is a big threat. And this is, we see that this is also related to global trends, but we really saw the need to now intervene as a collective to ensure that we kept this.
Now, when we talk about South Africa being one of the large centers of crime globally, medicines or falsified medicines is not something that's on the agenda. So what is it that allows for this practice to proliferate so rapidly?
There are various factors. Remember, we import a lot of medicines here and medical products here in South Africa, and we are globally connected. So with our resources, criminal activities see us as an opportunity, especially to leverage on gaps where access to medicine may be at risk. However, also, if you look at our regulatory framework, it's very, very strong, and we've got quite a wide range of medicines that are available, that are authorized in the market. And we also have online platforms that are easily accessible at a global level. So there are various access means that this opportunism activities that are illicit leverage on. However, also those that are authorized in the market as well, some batches do fail, which results in substandard products which have to also be recalled. But in general, because we are a major importer and there are only 7 ports of entry for medicines and medical products in South Africa, so there are other land border posts which we since have seen that there is a need as well to strengthen availability at those border posts. And also, if you look at regulatory frameworks, we needed with other law enforcement agencies to ensure that we collaborate so that we can fully work on the prevention, detection and response to this problem.
So as head of regulatory compliance, how much of your work involves putting measures in place to stem the flow of these medicines into the country? And the reason I ask is because you've said over the last few years, the numbers continue to double year on year. So that's pretty scary when you look at the implications of all of that.
Indeed. Remember the access to technology as well. And we're living in the AI period and machine learning period. So these are enablers, major enablers of this increase. And also our detection interventions as well are helping us indeed to also be able to detect these and respond to these and report on these. However, so these, because of us being global and people having access to these platforms, so that's how then we realize that this is increasing. And fortunately, we also publish this on the website so that you can even see as well for the public to be aware of these as well. So yeah, indeed, we had to intervene as a collective and ensure that from prevention, because we're talking about the law. So we look at the relevant laws, like for Border Management Authority, we look at the National Prosecuting Authority, we look at the police, we look at the Medicines Act. We then also look at the Customs Act to make sure that how can we then, through perhaps MOUs, prevent this, respond to this, and also detect these, and strengthen our actions, and also leverage on education and awareness while we're working with academia, and also the supply chain to look at how can we work on track and trace through the supply chain, involving the industry players. These are your business sector and the supply chain stakeholders to ensure that we come together and say, how do we prevent, detect, and respond? Because regulatory compliance on a daily basis, it's our job, from control of imports throughout the supply chain, sampling and testing. This is our responsibility to ensure that we keep this from the market.
Mokgadi, what do these medicines look like in practice? I mean, what are people buying and consuming without realizing the danger?
The common one that is currently happening is the weight loss products. So these are mostly advertised online, either by influencers or ordinary people, and also these illegal sellers. This is, for example, you would know that we've got Ozempic and also Mounjaro products, which are currently used for type 2 diabetes. And they also have got side effect of weight management or weight loss. So people are falsely advertising products which are not authorized, purporting to be these, and being sold online. And this can never be sold online. This is just one example. And others, it's your testosterone and some skin whitening, skin lightening products. And these products, the active ingredients that they contain, these must be controlled through pharmacies, through doctors' practices and establishments that are registered within the health sector, and also through the professionals which are trained to do so. Like in pharmacies, it will be pharmacists that will oversee the sale of this through prescriptions.
Now, I'd imagine that there's certain groups that are more vulnerable than others. You've obviously talked about individuals that are looking to lose weight, and you've mentioned some drugs which assist in doing that. So I suppose the combination is that there's a desire to do that. But let's also touch on performance-enhancing drugs. And we're not just talking about stuff in the gym for those that want to get bigger, but you know, there are also a lot of sexual performance-enhancing drugs on the market. How much of this is actually legitimate?
These are highly scheduled products, and these must also be sold through a prescription, from a doctor's prescription. This cannot be sold over the counter. Therefore, they can only be sold in health establishments, practices. And you're raising a very important, when you speak about lifestyle products and also for performance, there are a lot of some of the products that are on the market, they actually conceal what they actually contain, so that people can buy them and have sort of quick reactions, and they think these are working. Actually, they are likely to be containing very hazardous substances which are prohibited or highly regulated, some even internationally controlled. So that is why we are urging people to first seek assistance on medical products from health professionals, just to be sure. And also they can verify through health professionals if they buy them elsewhere. But we really recommend that health products be sold through legitimate supply chains and by professionals that are registered. And indeed, this is how we can together work towards keeping this problem.
Now, South Africa is launching the continent's first national action plan. What makes this plan different from other regulatory efforts we've seen before?
What makes it different is that this one, we are doing it in collaboration with the WHO. So the WHO has drafted a handbook for developing a national action plan, and South Africa was selected as the first country that they will work with to test this plan. And we have worked as a multi-sector platform. This involved us as a regulator, the National Department of Health, government from the enforcement sector, DTIC, and we also have got your Border Management Authority. We also have the industry supply chain, the business stakeholders, and we have a whole lot. We've got academia as well playing part. So all this, we came together, and through our leadership, we have come together to identify what are the pinch points, what are the key priorities that we can work on together to ensure that from prevention, detection, and response strategies to fighting the fakes and the substandard products in our market, holding hands, how do we prioritize? And this, we will be launching it on the 30th, which is very, very exciting. Our minister is going to launch this, and we will also be having other continental players, like from the NEPAD side, the African Medicines Harmonization. And also we will be having our SADC medical regulators also joining us, and the WHO and partners, of course, will also be there, and other global players who will be also joining online, the Pharmaceutical Permanent Crime Fighting Platform, which South Africa is a member of. They will also be joining us. So this is a very multi-stakeholder approach, and our action plan following the launch, then it will mark the end of the pilot of WHO. And we will also be presenting this to the global member state mechanism on fighting substandard and falsified medicines at the WHO in November.
Mokgadi Fafudi, SAHPRA's Head of Regulatory Compliance. Appreciate your time. Thank you so much for speaking to us as South Africa on September 30th gets ready to launch what will become the first in Africa, which is the National Action Plan to combat falsified and poor quality medicines.